कंटिन्यूस मेडिकल एजुकेशन प्रोग्राम बताते हैं, वो हमने पारस हॉस्पिटल की वजाहत से कार्डियोलॉजी और कार्डियक सर्जरी में नई है। नई का मतलब ये है कि वो पेशेंट्स जो बहुत ज़्यादा बुरी हालत में होते हैं और कोई इंटरवेंशन करना हो या कोई सर्जरी करनी हो कार्डियक, उनका रिजल्ट कैसे बेहतर से बेहतर बना देंगे। तो दो लेक्चर्स थे। एक डॉक्टर फयाज अहमद शाल साहब हैं जो अमेरिका से आए हैं, टेकोमा पार्क वाशिंगटन एडवेंटिस्ट हॉस्पिटल के डायरेक्टर हैं कार्डियोथोरेसिक लैब के। उन्होंने एक पहले लेक्चर दिया, उसके बाद दूसरा लेक्चर दिया डॉक्टर हरिंदर के बाली ने, जो पारस हॉस्पिटल पंचकुला में चीफ हैं, और उनने भी कुछ नई तकनीक का डिस्कस किया जिससे पेशेंट बुरी हालत में होके भी इंटरवेंशन कर सकते हैं और वो बच सकते हैं। शाह साहब के बारे में मैं इतना बताना चाहता हूँ कि इनमें हमारे स्किम्स में हमारे कैथ लैब डेवलपमेंट में बहुत बड़ा रोल अदा किया है। 2005 से लेके मुझे लगता है जब मैं भी वहाँ था, तकरीबन हर साल आते थे और जो मुश्किल से मुश्किल कोई भी इंटरवेंशन था इन्हें हमें वहाँ पे करके दिखाया और हमें सिखाया, और हम इनके बहुत शुक्रगुजार हैं कि जो आज हम यहाँ कार्डियोलॉजिस्ट या कार्डियक सर्जन काम कर रहे हैं, जो स्किल्स से पढ़ चुके हैं, उसके लिए हम बहुत शुक्रगुजार हैं। उसके बाद और 3 लेक्चर्स थे। एक कार्डियक सर्जरी के बारे में थे जिसमें बिल्कुल बड़ा स्कार नहीं होता है। नॉर्मली आपको पता होगा कि बहुत बड़ा स्कार चीर फाड़ करना पड़ता था स्टर्नम को, लेकिन ऐसा आजकल बिल्कुल नहीं है। तो डॉक्टर असरार साहब जो इस हॉस्पिटल से मुंसलिक हैं, उन्हें ये बिल्कुल बहुत अच्छे अंदाज में हमें बताया कि कैसे छोटे से छोटे इंसिजन से वो बड़ा से बड़ा ऑपरेशन कर सकते हैं। इसके अलावा कार्डियक सर्जरी के अलावा इंटरवेंशनल कार्डियोलॉजी में डॉक्टर सोहेल साहब ने अपने बहुत मुश्किल जो 2 केसेस थे उनका बताया कि वो कैसे उनने वो यहाँ पे पाया। इसके अलावा हमारे एक और विजिटिंग फैकल्टी थे जिन्हें हमें कार्डियक जो डिफेक्ट्स होते हैं अंदर हार्ट में, स्ट्रक्चरल या वेल्व के हों या सेप्टा के हों, उनका उन्हें बताया कि कैसे हम उनका अच्छे से विदाउट सर्जरी इलाज कर सकते हैं। मैं डॉक्टर शाह साहब से गुजारिश करता हूँ वो मुझे अपने राय इस बारे में बता दें।
Oh, thank you, Dr. Rashid. What he said was that we were able to discuss new technologies and new facilities like PARS, where people can have intervention without surgery. I have been here for the last 2 days, seeing patients and looking to their infrastructure. I think Kashmiris should be very happy that they have a good hospital here with all the facilities like we have in America, and they have excellent cardiologists, excellent skills. By that, people don't have to go outside J&K. They can come here and have all the facilities, particularly now in the heart disease. Heart disease is the #1 killer in the world, and they have all the facilities here. I think as a press, you need to make people aware symptoms of heart attack, because a lot of people are dying here because of heart attack. The key thing is the early recognition of symptoms and coming to quickly and have the treatment, or we can open these blocked arteries which cause a heart attack. So I think that's all I have to say is that I'm very pleased that I'm here for 2 days, that we have a great facility here with great skilled, great experienced doctors here, which can do a lot of things as we do in America. They have all the facilities here. So if you have any questions, I'll be more than happy to answer.
Also, you have been here in Kashmir, I think, some 10, 5, 7 years ago.
Yes, yes.
You were actually planning to set up a hospital here, but the then government refused to.
Yes, you're right, you're right. It was about 10 years ago, I had this dream of developing a hospital where patients who can afford to have it done, then I don't want to go to the politics.
How much in medical, as far as medical facilities are concerned, how much change you have noticed it?
Oh,
Then and now.
Oh, tremendous change. I think the facilities are phenomenal now. I mean, I've been here for 2 days at Paris and I'm very impressed. Much better and more when I was here 5, 10 years ago.
Many young persons have been died, with the heart attacks.
Yeah.
We have seen past many years. What is the main reason you have find that many young people have been died with this disease?
I think the number one is people who smoking.
Right.
Number two is diabetes. We call it the silent killer. Every fourth person in Kashmir is diabetic, diabetes. Then patients with high blood pressure. And also patients with bad cholesterol level, high cholesterol, especially LDL. And his father, mother, brother had a heart problem. They are more likely to have the same thing. And stressful situations and not having good lifestyle, eating habits. And these are the really things which to make early diagnosis of blood pressure, early treatment of diabetes, early treatment of high cholesterol. If you do that, you can prevent not only a heart attack, you can prevent surgery, you can prevent angioplasty. Because there is so much of advance now in these early checkups, early treatment, like a car. Suppose you have a car, you get regular checkups. That's important, not to wait till something else happens. Make early checkups, early diagnosis.
People are using the junk food so much today in today's life.
Well, that is the number one cause then, as I said.
What precautions should we take in case of health, especially heart disease and other things like that?
Well, what we have to do is, if you are diabetic, to have the right treatment at early stages. And the eating habits, exercise. If you have high blood pressure, to get early treatment. Not to wait till something happens. Same as if your cholesterol is high. We have now great drugs we call statins. They are modern medical medicines. So if you have a very high cholesterol, a bad cholesterol called LDL, you give them statins. There's a 50% reduction in heart attacks with that medicine called statins. They can even prevent new blockages if you give them early. That's the key thing, early lifestyle changes and early treatment. And people have to be aware if they have chest pain, the shortness of breath, pain going down the left arm, they're sweating, this could be the part of the heart attack. And they have to get early treatment for that.
So I've seen people here, they still have suffered heart attacks. That means despite stenting procedures, they still are on the same page. So could you please enlighten us about the early diagnosis of heart cardiovascular disease? Because delayed diagnosis, it really risks the lives of people.
I think when you talk about early diagnosis, what checkups you need, do first simple blood test to check they don't have a high bad cholesterol. Have a early checkup that they don't have high blood pressure because they may have no symptoms. Say the diabetes, the silent killer. There are people walking with HbA1c of 8, 9, 10, and they're not aware that they have the sugar problem, and that is to be addressed very early. We call this HbA1c level has to be less than 7. Same as the LDL level has to be low. And if you suppose to have a stent put in, but you don't change your lifestyle, you don't treat your hypertension, you don't treat your sugar, you're going to have a new blockage. That's what can happen. You can have a stent, but there are 3 other arteries. You can get a new blockage. And you have to change your lifestyle. That's the key thing.
How do you see the health scenario? Do you think government...
Well,
we need to upgrade our healthcare system here, be it in the government hospitals, private hospitals.
I haven't visited any government hospital, but I know when I used to come to STIMS 5, 10 years ago, they made a tremendous progress while watching them to grow. But I can tell you from the private sector, it's the only hospital I had an opportunity to see. And as I said earlier, I have been here for 2 days seeing patients. I just did a procedure before I came down. I'm really impressed with the facilities they have.
Thank you, sir.
Thank you. Thank you.